Hello, so my name's Jane Simons, I'm Director of Nursing for Addaction. We work closely with Drinkwise Age Well. We're going to talk today about women and alcohol, and specifically we're going to look at the menopause, which is something that really isn't talked about enough. Okay, so the menopause is something that is part of the natural ageing process. In this country it tends to happen between the ages sort of 45 and 55 to women, and the average is around 51 in the UK. For about 1 in 100 women, it can happen below the age of 40, and that can happen naturally, or it can be as a result of having the ovaries surgically removed, or because of chemotherapy or radiotherapy, for example. Most women will experience some symptoms, and symptoms can vary both in what they are and also in terms of severity. So a lot of women will report experiencing hot flushes or hot flashes. They'll have episodes of insomnia where they find that it's really hard to sleep, so it may be that they fall asleep fine but end up waking up at 3 or 4 o'clock in the morning. And that might be because their temperature is rising, or it may just be that they're waking up. Women also report changes in their mood, which can be really challenging, and I've heard of women that go to the GP and actually they're diagnosed with depression or anxiety. So there may be symptoms of low mood and people might feel anxious, but actually this might be part of the menopause and some of those symptoms. So other symptoms can be that women can experience changes in their skin, vaginal dryness, and sex can be painful. And one of the more common ones that we probably hear about more is that because of a reduction in those hormones, our bones become more brittle and we can experience something called osteoporosis. As women age, and men to be fair, we can become more sensitive to the effects of alcohol. We retain less water in our body, and we tend to have more fat and less muscle, and alcohol is easier absorbed into muscle than it is into fat. So it's fair to say that moderating our alcohol intake can be good at any age. It's good for our physical and our mental health. But alcohol can have a real impact on some of those symptoms that I was just talking about that we experience when we're having the menopause. So alcohol is a depressant. A lot of people think it's a stimulant because when we go out and have 1 or 2 drinks, we feel really sociable and we feel like we can get on with things. But actually it's a depressant. So if you're already feeling that your mood's low or you're anxious, alcohol can have a really big impact on that and can actually make you feel worse. So the menopause can also affect our sleep, so that whole insomnia thing of waking up in the night. And I don't know if you've ever experienced when you've had 1 too many drinks, but often alcohol can give us really quite restful sleep. It's not peaceful sleep, and you can be up and down for the loo. So obviously that can also impact on your sleep. So around the age that we're starting to experience those menopausal symptoms, there's often other life stressors going on. We've got children that may be growing up and leaving home. We may be having relationship difficulties. We may be having to increase the amount that we're working, or we might have emotional care like looking after elderly relatives. And we see quite a lot of women who actually start to use alcohol as a way of coping. So if we're starting to use alcohol as a way of coping with some of those life stressors, it's really important at any age, but especially when we're coming into the menopause, just to be mindful that that doesn't increase. That with heavy drinking, we increase our risk of cancers, and especially breast cancer, of heart disease and liver disease. It's also well known that even a small amount of alcohol can interact with some of our medications. So if you are taking medications and you're wanting to drink as well, it's really important to have a conversation with your GP or with your practice nurse or even with your pharmacist at the chemist. So I don't want to come across as a killjoy. It's okay to have the occasional drink. We do recommend that you stay within the government guidelines, which is 14 units a week for men and women. Try not to have those all in one go, but spread them through the week, and always try and have 2 to 3 days a week where you don't have any alcohol. So if you are worried about your alcohol use, or you just want to talk to somebody, you can get in touch with us by going onto our website, which is www.drinkwiseagewell.org.uk. And if you're worried about the symptoms that you're experiencing, please go and see your GP or your practice nurse just to talk through.